Hello. This presentation on cold stress is to inform you about the health effects of working while temperature conditions are below optimal, especially when temperatures are to the extreme. I will discuss what could happen to a person's body and preventative steps to help protect employees from injuries caused by exposure to various degrees of cold temperatures. My name is Jeffrey Kahn. I worked as an industrial hygienist in Houston, Texas for 20 years. Texas is hot most of the year. It is really hot and humid in the summer, and the winters are short and not very cold. 7 years ago, I moved to Kentucky to work as an industrial hygiene consultant at Kentucky OSHA. I was not used to the colder winter weather here. I had to acclimate to the different temperatures and weather conditions. There are two types of occupational thermal stress. Many of you may already be familiar with heat stress in the workplace. We also have other training modules on heat stress within this same Kentucky Safe website. Both heat stress and cold stress can affect occupations such as outdoor construction, highway construction and maintenance, agriculture, factory manufacturing, warehouses, etc. Cold stress affects some work sites, such as meat packing and other food processing plants, all year long, regardless of outdoor weather conditions. These plants could be refrigerated indoors in order to preserve the meat and the food. Today, I will be talking to you all about the other temperature-related occupational thermal stress. Welcome to the Cold Stress Prevention webinar. The objectives. I will be discussing what symptoms a person could experience when exposed to extreme cold. I will include other factors that will also affect a person's ability to stay warm. I will discuss preventive actions and first aid care for overexposure. You will be informed about OSHA regulations, NIOSH guidelines, and ACGIH guidelines for occupational cold stress. Maintaining your body temperature is balancing heat loss and heat production. Over time, your body will decrease blood flow to your extremities and outer skin and shift it to the body core to keep the internal organs warm. However, this allows exposed skin and the extremities to cool rapidly and increases the risk of cold-related injuries such as frostbite and hypothermia. A thermometer tells you what the temperature is for the air surrounding you. However, other factors can increase the way your body reacts to the cold temperature extremes. Wetness from weather conditions, sweating, submersion of hands, feet, or entire body into cold standing water or other water sources can cause your body to lose heat more rapidly. Wet clothes will cause them to lose their insulating value. Air movement during cold temperature extremes is referred to as wind chill. It causes your body to lose heat more rapidly. Air movement from natural wind or from equipment or fans combined with cold air temperatures creates the wind chill effect. Your body will lose heat at an increasingly faster rate with every drop in temperature and increase in wind speed. This table shows a general risk of developing frostbite at various temperatures, wind speeds, and times of exposure. This is not absolute in all cases because of other factors such as wetness, insulating clothing, etc. Where does the heat go? The first rule of heat energy is that heat travels in the direction from hot to cold. As you can see in the photos on the left, the hot frying pan When placed on the laminate countertop, the heat from the hot pan travels toward and into the cooler countertop and melts it. The photo on the right shows that the heat from the countertop travels toward the ice cubes and melts the ice. As we saw in the previous slide, heat travels from a hot place toward a cold place. So when a person is working in a cold work site, the person loses body heat. Here are the 5 processes that make that happen. First, evaporation. That is when your skin sweats from doing physical labor, and sweat evaporates and cools the skin. Next, respiration. When you breathe air out of your lungs, internal heat and moisture is lost to the surrounding cooler air. Next, radiation. No, this is not like nuclear waste radiation. It is similar to the way a car radiator cools the engine. When the air directly next to you is colder than the body temperature, the heat leaves your body and travels toward the cooler air. Next is convection. When there is also added air movement or wind chill, the body loses heat faster because it is constantly losing heat to the cooler air that constantly keeps moving away from you. Last is conduction. When a person has direct contact with cold objects, such as tools, building, or machinery materials, the body heat travels out of the body and into the cold tool or machinery. When the clothes and gloves are dry, the heat loss from the direct contact is at about 3%. When the clothes are wet, heat loss increases to 5 times faster than that. When a body part or the entire body is completely immersed in cold water, heat loss increases rapidly to 25 times faster. Living creatures, including you, are designed to internally generate heat. Your internal core body temperature is measured by rectal thermometer and is actually about 1 degree higher than 98.6 degrees. Eating food is a fuel source for body functions and metabolism for creating heat. Physical activity with muscle movement creates heat. Increasing the amount of activity increases the amount of heat produced. Shivering is a self-defense mechanism that activates when a body is losing heat too quickly. When a person is doing their job in a cold environment, the temperature differences are trying to balance each other out to both become the same temperature. The amount of heat lost by a person can be a losing battle against the giant outdoors. When a person loses heat faster than it is produced, the core body temperature begins to drop and cold stress begins. Cold stress can even happen at temperatures above freezing when the temperatures are combined with wet and windy conditions. Cold-related injuries include the following: hypothermia, frost nip, frostbite, chilblains, and trench foot. Hypothermia is a medical emergency that occurs when your body loses heat faster than it can produce heat, causing a dangerously low body temperature. Normal body temperature is around 98.6 degrees Fahrenheit, as measured by oral thermometer. Hypothermia occurs as your body temperature falls below 95 degrees Fahrenheit. When your body temperature drops, your heart, your nervous system, and other organs cannot work normally. Left untreated, hypothermia can lead to complete failure of your heart and respiratory system and eventually to death. Hypothermia is often caused by exposure to cold weather or immersion into cold water. Primary treatments for hypothermia are methods to warm the body back to its normal temperature. The warning signs of hypothermia. When hypothermia starts happening, the victim himself may not be aware of these symptoms. Coworkers and supervisors may be the first to notice when someone is acting confused, has blank, glassy stares, has difficulty speaking, sleepiness, or loss of interest in their surroundings, shivering, numbness or loss of muscle control, and loss of consciousness. How to care for someone having hypothermia. Be gentle. When you're helping a person with hypothermia, handle him or her gently. Limit movements to only those that are necessary. Don't massage or rub the person. Excessive, vigorous, or jarring movements may trigger cardiac arrest. Move the person out of the cold. Move the person to a warm, dry location if possible. If you're unable to move the person out of the cold, shield him or her from the cold and wind as much as possible. Keep him or her in a horizontal position if possible. Remove wet clothing. If the person is wearing wet clothing, remove it. Cut away clothing if necessary to avoid excessive movement. Cover the person with blankets. Use layers of dry blankets or coats to warm the person. Cover the person's head, leaving only the face exposed. Insulate the person's body from the cold ground. If you're outside, lay the person on his or her back on a blanket or other warm surface. Monitor their breathing. A person with severe hypothermia may appear unconscious with no apparent signs of a pulse or breathing. If the person's breathing has stopped or appears dangerously low or shallow, begin CPR immediately if you are trained to do so. If they are conscious, provide warm beverages. If the affected person is alert and able to swallow, provide a warm, sweet, non-alcoholic, non-caffeinated beverage to help warm their body. Use warm, dry compresses. Use a first aid warm compress, a plastic-filled bag that warms up when squeezed, or a makeshift compress of warm water in a plastic bottle or a dry warm towel. Apply a compress only to the neck, chest, or the groin. Don't apply a warm compress to the arms or legs. Heat applied to the arms and legs forces the cold blood back toward the heart, lungs, and brain, which causes the core body temperature to drop. This can be fatal. Don't apply direct heat. Don't use hot water, a heating pad, or a heating lamp to warm the person. The extreme heat can damage the skin, or even worse, cause irregular heartbeats so severe they can cause the heart to stop. You may need to call for professional medical assistance. Their medical treatment may involve some of the following procedures. Depending on the severity of hypothermia, emergency medical care for hypothermia may include one or more of the following interventions to raise the core body temperature. Passive rewarming for someone with mild hypothermia, it is enough to cover them with heated blankets and offer warm fluids to drink. Blood rewarming, blood may be drawn or warmed and recirculated in the body. A common method of warming blood is the use of hemodialysis machines, which is normally used to filter blood in people with poor kidney functions. Heart bypass machines may also be used for this purpose. Warm intravenous fluids. A warmed intravenous solution of salt water may be put into a vein to help warm the blood. Airway rewarming is the use of humidified oxygen administered with a mask or nasal tube can warm the airways to help raise the temperature of the body. Irrigation. A warm saltwater solution may be used to warm certain areas of the body, such as the area around the lungs or the abdominal cavity. With this procedure, a warm liquid is introduced into the affected area with catheters. These last few that I've mentioned are to be done by medical professionals in a medical setting. What is frostnip? One of the early visible symptoms before frostbite occurs is red fingertips. If cold exposure continues, the fingertips turn blue. Then the whole fingers turn blue. This happens because the body protects the core body temperature by reducing blood flow to the extremities. A person can recover from frostnip if treatment begins immediately. However, if not removed from the cold and treated, it could lead to frostbite. What is frostbite? Frostbite is an injury caused by freezing of the skin and underlying tissues. First, your skin becomes very cold and red, then numb, hard, and pale. Frostbite is most common on the fingers, toes, nose, ears, cheeks, and chin. Exposed skin in cold, windy weather is most vulnerable to frostbite, but frostbite can occur in skin covered by gloves or other clothing. This illustration shows the type of reaction and damage caused by frostnip and frostbite to the skin surface and to the deeper layers of skin. Box 1 shows normal, healthy skin. Box 2 shows frostnip that causes redness to the skin surface only. Box 3 shows light frostbite causes blisters on the skin surface and slight damage to the upper layers of skin. Box 4 shows deep frostbite that causes black discoloration and death to skin cells on the skin surface and to the mid layers and deep tissue layers of skin. Symptoms of frostbite may also include loss of feeling to the damaged area. They can be cold to the touch and waxy purple skin. Severe stages of frostbite often leads to amputation. How to care for a person with frostbite. Rapid attention is needed to minimize frostbite damage. Remove person from the cold environment. Remove wet clothing. Do not rub or massage the area in an attempt to improve circulation. Loosely bandage or wrap the area with sterile cloth. Since there are various stages and severity to frostbite, you should seek professional medical attention for further evaluation, treatment, and follow-up. What are chilblains? Chilblains are the painful inflammation of small blood vessels in your skin that occurs in response to repeated exposure to cold, but not freezing air. It's also known as pernio. Chilblains can cause itching, red patches, swelling, and blistering of the hands and feet. Anyone can get chilblains, but it is more common in women, being underweight, being in a cold and damp environment, having poor blood circulation, having other autoimmune conditions such as lupus or Raynaud syndrome. Chilblains usually clears up within 1 to 3 weeks, especially if the weather gets warmer. You may have reoccurrences seasonally for years. Treatment involves protecting yourself from the cold and using lotions to ease the symptoms. Chilblains don't usually result in permanent injury, but the condition can lead to infection, which can cause severe damage if left untreated. The best approach to chilblains is to avoid developing them by limiting your exposure to cold dressing warmly, and covering exposed skin. How to care for a person with chilblains. Remove the person from the cold environment and rewarm the area slowly and gently. Do not rub, massage, or use direct heat on the areas. Keep the skin warm and dry. Do not scratch even if the skin itches. Instead, apply lotion to control the itch. Clean the area with an antiseptic to prevent infection. What is trench foot? Trench foot is a medical condition caused by prolonged exposure of the feet to damp, unsanitary, and cold conditions for several hours or days. It is one of the many immersion foot syndromes. The use of the word trench in the name of this is a reference to trench warfare, mainly associated with World War I. Symptoms include a tingling or itching sensation, pain, swelling, cold and blotchy skin, numbness, and a prickly or heavy feeling of the foot. The foot may be red, dry, and painful after it becomes warm. Blisters may form, followed by skin and tissue dying and falling off. In severe cases, untreated trench foot can involve the toes, heel, or entire foot and could cause permanent damage. It can be quite painful, but it can be prevented and treated with proper care. How to care for a person with trench foot. Proper self-treatment consists of changing socks 2 or 3 times a day and the use of plenty of talcum powder. Whenever possible, shoes and socks should be removed. The feet should be bathed for 5 minutes and then patted dry. Talcum powder applied, and then the feet should be elevated and allowed to let air get to them. Work performance speed and quality can be decreased while working in cold conditions. Coldness can interfere with mental alertness and concentration, especially during complex mental tasks. Trying to stay warm may cause restlessness, constantly moving, or fidgeting. Coldness can interfere with normal body movements because of numbness, muscle weakness, joint stiffness, and pain. These things make it more difficult to perform manual and mental job tasks when also combined with cold, wet, and/or slick conditions. The risks of job-related accidents and injuries are greatly increased. Several other factors may add to the risk of cold injuries and illnesses. Caffeine increases urination, which increases fluid loss, leading to dehydration. Nicotine may lead to poor blood circulation, which may increase risk of injuries from frostbite and trench foot. Tight-fitting clothing may lead to poor blood circulation. Underactivity reduces the amount of body heat produced. Overactivity increases body heat production, which leads to more sweating and wet skin and wet clothing. Underdressing is typically from not covering skin of hands, fingers, nose, ears, and head. Overdressing does not allow enough heat to leave the body and leads to excessive sweating, wet skin, and clothing. As the length of time spent in the cold increases, the body temperature decreases. Older adult workers could be more likely to have cold-related injuries due to underlying health conditions such as poor blood circulation, heart conditions, etc. Dehydration can result from excessive sweating or from not drinking enough fluids. Don't rely on the feeling of feeling thirsty before drinking. Examples of some engineering controls in cold weather work sites include, but not limited to, the following: radiant heaters, warm air jets, contact warm plates, barricades to block wind and air movement to reduce wind chill effect, and heated shelters for providing warming breaks. Additional engineering controls may include covering equipment handles and other frequently contacted metal surfaces with thermal insulating material. Direct contact with cold metal removes heat from the body extremely fast. Select or modify machinery and tools so they can be safely used and operated while wearing gloves. When an employee is also exposed to vibration and/or toxic substances while working in a cold environment, the exposure to cold should be reduced. The combined effect of excessive cold with vibrations increases the risk of HAVS, which is hand-arm vibration syndrome. Also, excessive cold with certain toxic substances can intensify cold-related injuries. Clothing is an important part of maintaining a person's body temperature by preventing heat loss. Using the layering effect of clothing to balance the rates of internal heat production, sweat production, heat loss, as we've discussed earlier, and staying dry. The first layer next to your skin should be able to pull sweat and moisture away from the skin and keep it dry, thus reducing the wind chill effect. The next layer should be insulating and thicker to hold in the body's internal heat. The outer layer should be protective against wind and outside sources of water. As I discussed earlier, wind and water greatly increases the rate of heat loss from your body. Wet clothing loses its insulating property in cold weather. The weakest link in overall body heat loss is through the head. Wear a wool or knit cap to cover the top of the head and the ears. If you must also wear a hard hat, find a cap that's appropriate for use under the hard hat. Wear a mask or a balaclava to protect the nose, cheeks, and/or ears. Certain occupations might need eye protection from blowing snow or ice crystals. The hands and fingers are likely to lose heat by direct contact with cold materials, cold air and wind, sweat or cold water, poor blood circulation, and/or lack of proper clothing and gloves. Depending on job tasks and the dexterity needs and other hazards that may be present, selecting the right glove is important. Generally, mittens provide the most protection against heat loss, but limit dexterity, which is the use of the fingers. Full finger gloves provide the second level of cold protection and allow more dexterity. Fingerless gloves are in third place for cold protection, but may be necessary for finger control of some job tasks. Under cold working environments, when employees must work without gloves or wear fingerless gloves, the employer could provide hand warming devices such as warming plates or hand warming packets. Many glove makers offer double layer gloves that protect against the cold and also protect against water and various chemicals and cut resistance, all combined in one glove. While working in a cold and dry area, wear leather boots that will allow sweat to evaporate while protecting the skin from wind chill heat loss. If possible, wear insulated boots with removable liners that could allow daily drying of those liners. Socks are available in many different thicknesses and materials to provide the needed amount of heat loss prevention. Change socks and boots if they get wet, especially if you step into cold water and saturate them. While working in wet conditions, such as firefighting, farming, or other wet areas, boots must be waterproof. If there are crushing hazards to the foot, the boots must have a steel toe protection. Keep clothing dry because wet clothing loses its insulating properties, and when combined with wind, the body loses heat much faster. Remove excess water and snow from the clothing while you are taking a break in a warming shelter. Keep a complete set of dry clothing and boots available to change into in case any of them get wet. Avoid wearing too much clothing to avoid excessive sweating. If you get too warm due to strenuous work or changing weather conditions, remove or replace the extra layers of clothing. Your body can lose heat at a dangerous rate if the clothing is wet and the worker remains in the cold environment, and the chances of developing frostbite and hypothermia could develop quickly. General work practices for working in cold weather are as follows. Pace your work. Avoid excessive sweating. Change into dry clothes if the clothes become wet. New employees should be given time to acclimatize to the cold conditions. Protective clothing should be worn. Avoid sitting or standing still for prolonged periods of time. Take frequent breaks in shielded areas out of the cold and prepare for the cold conditions. Work in pairs to keep an eye on each other and watch for signs of cold stress. Consume warm, high-calorie food, such as pasta, to maintain energy reserves. Working in the cold requires more energy to maintain body heat. Drink plenty of warm liquids often, especially when doing strenuous work, to prevent dehydration. Avoid caffeine, which increases urine production and contributes to dehydration. Avoid alcohol. When it is cold, do not brush up against metal surfaces with bare skin. Your skin may stick to it and immediately develop frostbite. There are no OSHA standards which specifically address the potential hazards of cold-related stress injuries and illnesses in the worksite. However, the Federal Occupational Safety and Health Act of 1970, Section 5A1, is the general duty clause, which requires employers to provide a safe and healthy workplace, which is free from recognized hazards that could cause death or serious harm to the employees. When there are not existing OSHA standards for hazards such as cold stress, recommendations and guidelines by recognized professional organizations might be used in conjunction with the general duty clause to be cited by OSHA. The following resources can be used by employers to help them develop procedures for protecting their employees from cold stress-related injuries and illnesses. NIOSH is the National Institute for Occupational Safety and Health. NIOSH has published Fast Facts Protecting Yourself from Cold Stress. ACGIH is the American Conference for Governmental Industrial Hygienists. The ACGIH publishes the ACGIH TLVs and BEIs annually. These documents are copyright protected, but they are available for purchase by anyone. TLV stands for Threshold Limit Values, which are established by ACGIH. The TLV for cold stress is set to prevent the internal core body temperature from falling below the threshold for developing hypothermia. There are several guidelines within this ACGIH publication for protection against cold stress in the workplace. JAMA, which is JAMA, is the Journal of the American Medical Association. They publish peer-reviewed articles by physicians and other medical groups, which may include things such as updated techniques for first aid treatment of hypothermia and frostbite. The American Red Cross is a recognized agency for providing certified training in first aid. They also publish safety tips for disaster preparedness, including topics such as winter storms. Thank you for attending the cold stress prevention webinar.